What's going on, everybody? Will Koopal Functional Medicine coming to you from the Good Life City here in Albany, Georgia. So today I wanted to hop on and talk about this GI map stool test that I've been running on patients. And the more I learn about it, the more it just is mind-blowing because the gut modulates so much of human health. So the microbiome consists of trillions of bacteria, viruses, sometimes parasites that all act synergistically together to create human health or disease. So the gut modulates about 70% of the immune system. Most of the chemicals used in the brain are made from that gut. So if you're having depression, anxiety, ADHD, other mental health problems, this is the test for you. If you're having other non-specific issues that you aren't getting answers to, such as sinus issues, skin issues, fatigue, joint pain, this is also good. And the one of the main things I use this for is autoimmune diseases. Autoimmune diseases are skyrocketing here in America, likely due to all these chemicals and environmental toxins that God did not design. So our bodies were not programmed to deal with those. So the most important aspect of any testing is a good, solid clinical history. So before I order this test on you, I'm going to send you some intake paperwork. I'm going to get loads of history on you so I can understand this and look at this test through your history. That is key. So we want to put it all together, and we're not just going to look at one marker on this test. We're going to kind of put it as a whole, along with your history, severity of symptoms, diagnoses, and then we'll kind of give you a treatment from there. So as you see here, this first page, it is for pathogens. So luckily, DADS did not register. Shout out to Bob Koopal for letting us use this as a sample report. But as you see here, it's looking at bacterial pathogens, which I'm sure you've heard of these. These can be tested for in traditional medical settings. They usually present with nausea, vomiting. They usually are short-lived. They usually go away on their own, and they are mostly from fecal-oral transmission, contaminated water, contaminated food, seafood. But these can be some nasty infections. So we want these to be negative. If they're positive, we can deal with it. But one may ask, why would someone be susceptible to developing one of these pathogens? So if you have dysbiosis or a abnormal microbiome, it can set you up to getting one of these pathogens. A low immune system is huge, which we'll look more in depth at the immune system on this report. And then low digestive capacity. So if you can't digest the nutrients that you're eating, assimilate them, pull those nutrients off of the food, and send them to all the cells in your body to do all the work in our body, those three things can kind of set you up to developing one of these pathogens, which can cause major health effects. So that's page one. That's looking at pathogens. And then we'll move on here to page two, which is H. pylori. Helicobacter pylori is a very serious and common infection. So about 50% of the population has H. pylori. It's associated with stomach pain, gastric ulcers, even some cancers. It's highly transmissible. So if one of my patients has it, I always recommend their families getting treated. I treat lots of families. So we've got to think of this thing as a whole, right? That's what functional medicine is. We're getting to the root cause. So if your family's sick, your chance of being sick is much greater. So this is, like I said, highly transmissible. So I guess dad was smooching on mom and maybe she's got H. pylori. I don't know. But she needs to get tested for it. And if hers is high, we'll eradicate it. So his level was kind of in the gray zone. So as you see here, he was positive, but it didn't light up red for a high level. And then none of those virulence factors showed up. So if you get a very high level and those virulence factors light up red, I'm definitely going to treat it. But if it's a lower level like this, we may just not treat it and try to crowd it out by increasing his microbiome health and increasing his immune system and his digestive capacity. So, like I said, H. pylori is very, very prevalent, but we've got to take into account the clinical history and everything else on the report to make a call on whether we want to treat it. So traditional medicine, we're going to treat it with antibiotics, which I can prescribe medicines. Sometimes I will choose to do that, but oftentimes I use herbal medications to treat this. They're just as effective, and herbal medications have lots of other beneficial properties, whereas medications usually have side effects and they kill off those other healthy bacteria because they are antimicrobials, right? So for any gut pathogen we have, so the first one we've came here on Dad is H. pylori. It is positive. It's not super high. It's not negative. So what do we do with this? So there's a thing called the 5R protocol that we learn in functional medicine. So the 5Rs apply to any gut pathogen or gut problem we have. The first one stands for remove. So we're going to remove any triggers that damage the gut. Those are usually processed food, food allergies, food sensitivities, which I test for all the time, allergens, environmental toxins. So we're going to want to remove. We're going to want to replace essential nutrients, digestive enzymes may be deficient. Hydrochloric acid is often a problem. So we're going to remove, replace, we're going to re-inoculate that microbiome with healthy probiotics, prebiotics even, and then postbiotics. If we feel we need to do those, we're going to repair that gut lining, make sure it's not being damaged. As you'll see lower on Dad's report, he does have a high level of zonulin, which is indicative of leaky gut, which is a problem. And then the fifth R is we're going to want to rebalance his overall health. So to rebalance a person's health, we want to rebalance the modifiable lifestyle factors. So we're going to dial in his sleep, his stress, relationships, his exercise, and we're going to get to the bottom of the matrix, which are those modifiable lifestyle factors. So once again, for all of gut problems, we're going to remove the bad stuff, replace with good stuff, re-inoculate that microbiome, repair that gut lining, and rebalance the whole human being's modifiable lifestyle factors. 5R approach. So that was the H. pylori. And then the second part of page 2 is the commensal or the keystone bacteria. So this is the bulk of the microbiome, those trillions of bacteria. They live in the small and large intestines. And this helps with absorption of nutrients, assimilation of nutrients. Some of these bacteria actually produce vitamins. They do lots of things. They make the chemicals for our brain. They create or turn off inflammation. So they are very powerful, and we can go in the weeds with all these individual commensals. But basically, that's what I want you to know about these commensals. We want to make sure they're in a healthy range, which most of Dad's are. So one of the ones I did want to touch on is the Akkermansia. If you see that here, it's about the fifth or sixth one down. So that creates it creates the mucin layer in the gut, which is critical for overall health. So Dad's commensal bacteria look good. If you move on down here to the last part about the phyla, so you think of the phyla as like a big zoom out of the microbiome. So Dad's Bacteroides was low. So you want it to be high. That would be like a lush rainforest. It's very healthy. The Bacteroides is low, so it's kind of like a dry desert. Sorry, Pops, but we got to work on the Bacteroides. So what creates a low Bacteroides? It's likely from low immune system, digestive insufficiency, maybe the H. pylori is contributing to this. So we've got to think of everything, right? We're going to get that clinical history. We're going to do a deep dive in his health to figure out why this is happening. That's the fundamental question we're asking with functional medicine. Why, right? Other things that can cause disruption in the gut are foods, drugs. A lot of the women I see have been on oral contraceptives for a long time. Those are very hard on the gut. NSAIDs are very hard on the gut. Antidepressants, antipsychotics, PPIs, proton pump inhibitors, those are for acid reflux. Very common medication I see people on. If I see people on that, I generally stop them, put them on an herbal that works just as good, but has better, no side effects, but good benefits. See a lot of people on metformin, laxatives. These can all mess with that gut microbiome and give you a low bacterial phyla. So this Bacteroides, it's a main producer of short chain fatty acids, which basically feeds the gut. That is super, super important for overall health. So that's page 2, basically, is the commensals was page 2 here, and the H. pylori. So we'll move on here to page 3, the opportunistic or the overgrowth microbes. So his looked pretty good, but you see we have a few opportunistic or overgrowth microbes, and we can treat those individually. But once again, we're looking at it as a whole. Clinical history, what meds is he on? I don't think Dad's on any meds, but if you were, could this be playing into it like I just discussed? So with his overgrowth, our approach basically is going to be to crowd it out so they can become healthy once again. We're going to increase that Bacteroides phyla, like we just talked about on the last page, and try to bring these within range. So under that is fungi and yeast. So this is very common to see yeast overgrowth. With a standard American diet, yeast loves sugar, processed carbs. So typically people will present with being very gassy, stomach pain, some have diarrhea. We can also glean insight into SIBO, which is small intestinal bowel overgrowth. We can glean insights into food sensitivities based on this report. However, it doesn't necessarily test for food sensitivities. I have another test that I use for that. It's called the KBMO Fit Test. Watch my next video. I'll be shooting that here in a couple of days about the food sensitivities. But that is page 3 here. The last part of page 3 is the viruses. As you see, his is negative there. Page 4, moving on to parasites. He did not register for any parasites or worms, but I do see these quite a bit. And once again, usually the root cause for a person having parasites are low immune system, bad digestion, and dysbiosis. So basically, we're going to treat those 3 things when this report's off. So the last part of this report are the intestinal health markers. So the steatocrit and elastase are digestive markers that tell us if you're digesting that food okay, can your body pull those nutrients off and assimilate them into the body for overall health. If these are off, you're likely going to have nutrient deficiencies, which can lead to lots of problems. The next marker is the beta-glucuronidase, which is basically that recycles garbage, basically. So if you're having hormonal problems, we're definitely going to want to hone in on this beta-glucuronidase. It's also checking for occult blood fit. If I see blood on anyone's stool test, then you will have to go to your primary care. Recommend all of my patients have a primary care, and then they will likely do a colonoscopy to investigate even further. But once again, that's just one aspect of this test. We're trying to look at it as a whole, along with the clinical timeline and the history. Next part of this is the immune response, secretory IgA. That is a good marker for your stress levels. If the secretory IgA is very low, that tells me you're likely chronically stressed. If it's very high, that tells me you likely have a lot of gut inflammation. Anti-gliadin is a marker for celiac or wheat sensitivity and or allergy. So in today's modern world, all of this gluten and wheat is hyper-processed, is sprayed with a bunch of chemicals. So I see a lot of people have problems with gluten and wheat, And if we can get them to stop eating that, a lot of time that significantly helps the overall health and get rid of a lot of these nagging symptoms. The eosinophilic activation protein is another inflammatory marker. The next one is the calprotectin. That is associated with irritable bowel disease, which can be very serious. So if that's high, we'll likely set you up with a GI doc to do a colonoscopy. And while we're working on correcting the immune system, the dysbiosis, and the digestion, that's probably the root cause. But while we're working on that, we want to make sure we're covering our bases so you won't have any major problems. The last thing I did on Dad was an add-on test, gluten peptide. That just basically means he needs to cut out gluten and wheat. The zonulin, that is a key marker I add on every single one of my GI maps. That is a marker of leaky gut. So if your gut is leaky, I guess the professional term is intestinal permeability. So if your intestine is permeable, then things can seep in through your gut. Right behind that gut lining is your blood vessels. So food particles, allergens, all these chemicals in our food can seep in to our bloodstream and cause major problems. Lipopolysaccharide is another thing that can just wreak havoc on the human body. So we want to look at that. And then the last page of the report is H. pylori antibiotic resistance genes. So as you see, all of his were absent. But if some of these are positive, it will kind of help direct my choice in medications if we try to go with a traditional antibiotic. But like I said, 9 times out of 10, I'm going to use herbals because they have lots of good benefits. They're not going to be killing off that dysbiosis. So basically, that's Dad's report. Just kind of to review, no bacterial pathogens. Those are usually acute. But what sets a person up for that is low immune system, exposure to contaminated food, water, contaminated seafood. If you have a low immune system and dysbiosis, that's going to set you up to get those. The H. pylori, his is kind of middle of the line. We're going to check my mom, his wife. They've been smooching, right? So we're going to check her, make sure hers isn't off the charts. We're going to recommend them to get new toothbrushes. Look at a few other things within the household to kind of clean that up. And we will take care of that. The commensal bacteria, his looked relatively good. However, the zoom out view, the bacterial phyla, he was low on the Bacteroides. So we're going to do things to improve his short chain fatty acid production, which has a host of beneficial effects. And then he had some overgrowth microbes. So that tells me once again, he does have dysbiosis. So we're going to utilize that 5R approach to heal his gut. No fungi or yeast overgrowth, no viruses, no parasites, and then his intestinal markers look pretty good. But once again, those are markers of digestion, hormonal recirculation, immune response, markers of gluten and wheat sensitivity and allergy, calprotectin, and then that leaky gut marker. So this is a very comprehensive report. We get lots of information from it. But like I said, we're going to get a super in-depth history. We're going to send you intake paperwork. I'm going to read that, do my homework on you before I interpret this test. I'm going to look at it through that lens. And then we're going to look at every single part of this report and put it together with the clinical history to come up with a treatment. So I do telemed visits also, see patients from all over the state. Love doing telemed. It's been a great addition to my practice. So if you or any of your family member or friends are struggling with any mental health problems, autoimmunity, definitely skin lesions, fatigue, joint pain, nonspecific symptoms that you're just not getting the answers to, I think we should definitely look into getting this GI map. And then basically once we get the report back, we are going to utilize that 5R approach, right? We're going to remove toxins, remove the bad foods, remove the environmental toxins. We're going to replace the nutrients. We're going to re-inoculate that gut with the right prebiotics, foods, probiotics, supplements, postbiotics, which can be some supplements. We're going to repair that gut lining with some other supplements, herbs, foods. And then the last thing, and probably the most important, is we're going to rebalance that entire body by looking at your sleep, stress, exercise, and relationships, and your exercise. So it's a very holistic approach to this, lots of nuances. We could go into weeds with this, but I really wanted to just give you a large overview of what this report was about. So if you enjoyed what you hear, shoot me a message. I'd love to chat with you. If you have any questions before you make an appointment, reach out to me. I'm seeing patients in the office or on telemed. Appreciate y'all listening. Thank you.